At the peak of the Lord's resistant army insurgency in the northern region, Ebola broke out in Gulo district, which was the epicenter of the rebellion. That was 22 years ago. Among those who died were medical staff including Dr. Matthew Lukwia, the then superintendent of Acholi Hospital. The administrators say they are prepared to fight the disease and control its spread.
For us now, we think it's very important to maintain a high level of alertness and high level of surveillance so that if one case appears in the hospital, it should be detected immediately. And that's what we are emphasizing on our staff now. Because this hospital is quite big. At any time we have at least 2,000 people in the hospital. So if an outbreak came in and is not detected in time, we fear that the disease can spread so quickly.
Dr. Dong says the hospital experience with Ebola is their greatest strength now that there is a new outbreak.
The experience we have had during the first Ebola outbreak in 2000, plus the experience which we have had in the last 2 years in preparation for the treatment of COVID-19, I think we are more alert than before. In 2000, the cases had already spread in the community. By the time the district realized, it had already spread so much, and that's why it was difficult to contain it.
The facility's Ebola task force will also carry out sensitization.
So we have set up a task force. Infection prevention committee is in place, and they're really doing a massive sensitization within the hospital first, including the schools, and then they will also go out to sensitize the community.
Information is very important, and the way people perceive information, it's different. You know, it varies from one person to the other. And in this context of epidemics, you know, we have a lot of myth, and now that is where we should actually fight. If we can get the common man out there to understand the disease transmission, we think as a country we would have done quite a lot actually.
Ministries should maintain their level of vigilance, and the most important thing is the provision of personal protective equipment for the ministry. The health workers actually know what to do, but if they don't have the right tool, like the personal protective equipment, then it becomes very difficult and dangerous for health workers to handle Ebola.
Meanwhile, at Gulo Regional Referral Hospital, the management has called on staff willing to work at Ebola Treatment Center to voluntarily register. Polycap Kalokwera, NTV.